I'm Dr. Rakesh Nair. I exclusively save or replace knees for a living. I get maximum work during a marathon. It's sad, but it's very true. Why does this happen? Why is it that during a marathon there is more injury than pleasure? Because everybody needs to understand that there is a big preparation before you start running for the marathon. Most of the time it is just a little instigation or a little motivation from somebody in the office who tells you, hey, aren't you running the marathon? And just to impress somebody in the office you decide that I want to run without any pre-op fitness levels, without doing any basic blood levels, and you run, and that's when you cause irreversible damage to your knees. This cartilage in your knee, there is like a 1 centimeter of cartilage which is there, which is supposed to be lasting you for a lifetime. What damage you cause it in a younger age group till around 30-35 is still remediable, can still be reversed. But if you are around 40-45 and you plan to do a marathon without proper preparation, there is a fair chance that you're going to cause irreversible damage to the knee, which would require surgery in the longer run. So just a few basic tips on what you should do and when you should consider yourself eligible, that you are one of the candidates who can run the marathon. Normally the training program for the marathon would be at least 6 months to 1 year prior to the marathon itself. You have to do your basic blood levels of a basic calcium, a vitamin D3 and a vitamin B12. You should get these levels, which have to be normal, because these are your basic ingredients in your body which is going to help you to recover. Your main muscles which are around the knee is basically the quadriceps, which is in the front of the knee, and the hamstrings which are at the back. So when I talk about training, I don't talk about just running. I talk about making the muscles around the knee strong so that the load doesn't come onto the cartilage and there is no damage done to your shock absorber or the cartilage. This training can be gradually increased, so it is important, again, if you can afford the facilities of a personal trainer who will help you with the weight training. You have to do weight training in terms of proper muscle strengthening. Without weight training, the whole brunt is going to come on the cartilage and there is going to be a lot of damage done to the knees, which is not going to be reversible. Obviously, it is obvious that you have to invest in a pair of good walking shoes or running shoes. And whenever you practice, again, it is important that you run on a running track. When I see these guys even running on our roads, fine. For the final thing, it's fine. But if you're going to do that on a day-to-day basis, it's going to be a problem. So it's always important that you practice on either a mud track or a grass track. If possible, take your car, take the rickshaw, go to one of these areas where you can have a track which is more conducive to your knees and it won't cause damage. The final run obviously might be on the road, but at least you're not causing damage when you are preparing for it. Listen to your body. I would still say the easy way out is to listen to your body. Push it to a level where you know that the recovery is happening. If any muscle pain, any injury is consistently there even after a week, 10 days, you have realized that you are running much more than the body can take. By that I am trying to explain to you is that the body gives signals. The muscles get fatigued. Like if you're doing a 1 kilometer, you're doing a 7 kilometer, you're doing a 22 kilometer run. You might be very comfortable for the first 7 kilometers because your body and your muscles have adjusted to that. When you're pushing it beyond that, at some point the muscles are going to go into fatigue and the whole brunt is going to come on the cartilage. At that level you have to tell yourself that I will run the 7 kilometers, I will run the 10 kilometers. If I want to increase my running, I have to first make my muscles strong. So then you go back again, see that you do more of the functional weight training where you're strengthening the muscles so that you can increase how much you can run. So again, the bottom line is listen to your body so that you don't cause any damage. When do I stop or when do I see the doctor? That's obviously that if you're fit, you're going to finish the marathon on that particular day, but you're going to have a lot of residual pain and deformity which normally might recover over a week, 10 days post the marathon. So if you adhere to these basic levels of keeping your normal blood levels of calcium, vitamin D, B12, proper running shoes, proper running track when you're practicing, and by strengthening your core muscles around the knee, which is your quadriceps and hamstrings, hopefully you will not have much damage when you run. Thank you.